Thank you for joining me on this webinar. I'm Karen Vachon. I'm a licensed insurance agent here in Maine, and I'm coming to you today to talk about 2025 Medicare updates. There are changes coming to your Medicare plan due to the Inflation Reduction Act and some other factors. Thank you for joining me. Who will be most impacted this year are going to be Medicare Advantage beneficiaries and prescription drug standalone prescription drug plan beneficiaries. Basically, 90% of Medicare beneficiaries are going to be impacted this year due to the Inflation Reduction Act. So what we're going to talk about today is why these changes are happening, what the changes are and how they may affect you, and what you can do to get ready for these changes. The Inflation Reduction Act, what it is, was signed into law August 16th in 2022 by President Biden, and it was designed to meet climate goals and benefit vulnerable populations, which include Medicare beneficiaries. The goal is to lower drug costs, expand benefits, and stabilize drug premiums. The Inflation Reduction Act has been rolling out for the past couple of years. The biggest impact come in 2025, but we started to see signs of it beginning in 2023 with a cap of $35 per month on insulin copays. At that same time that year, the federal government expanded extra help to 150% of federal poverty level. This past year, 2024, the maximum out-of-pocket cap was the first time we saw a maximum out-of-pocket cap on your prescription drug coverage, was capped at $8,000 per year. And additionally, the catastrophic cost sharing that once was 5% in years past went to 0% this year. Here's what's changing in 2025. The maximum out-of-pocket cap is going to go to $2,000. The donut hole, the infamous donut hole that people dreaded, will be eliminated. And a new program called smoothing will be introduced. This new program, smoothing, is for people that have very, very expensive prescription drugs that may have to buy a 3-month supply for a lot of money, can now smooth out those payments over 12 months, which will save on the budget. The new prescription drug coverage phases are changing. In the past, there's been 4 phases to your prescription drug coverage. As I mentioned, the donut hole goes away. So now there's only going to be 3 phases, which is going to include a deductible that could be up to $590. Then the initial coverage phase, up to $2,000. And then once you hit that $2,000, then you're going to cap till the end of the year, and you will have 0 cost for the rest of the year for all in-formulary prescription drugs. These are great changes and are going to provide great relief to people that especially have expensive prescription drugs. Of course, that also means that this program has to be paid for. So here's what you're going to see is drug manufacturers are going to pay more. Also, your insurance carriers with Part D coverage built into their plans, they too are going to pay more. And Medicare beneficiaries may see drug costs decrease. This will be especially true for people that have expensive prescription drugs. For people that have low-cost prescription drugs, you may actually see your prices go up. So as I mentioned, the greatest impact is going to fall on the Medicare Advantage plans and the prescription drug plans. And there's going to be some structure changes and shifting in those costs. So for example, you may see reductions in your network, in your Medicare Advantage plan. You may see reductions in your plan formulary. And in the Medicare Advantage plans, you may see reductions with your extra benefits. You may see increases in your plan premium, in your copays, in your deductible, and in the prescription tier pricing, and your maximum out-of-pocket cap in your Medicare Advantage plan. Here's what you need to do to get ready for the annual enrollment period that runs October 15th through December 7th each year. That is your annual enrollment period to choose your new plan for 2025. Now, the timing of this webinar is perfect. It's coming to you right as you will be receiving your ANOC, your annual notice of change, coming from your insurance company. And it usually arrives in your mail starting in mid-September to very, very early October. And what the ANOC tells you is what is changing in your current plan. Now, this is very dry reading, and we get a lot of mail this time of year. I encourage everybody, make sure this does not end up in your recycling pile. It's easy to overlook. I encourage you this year especially, open your ANOC and read it very, very carefully. For people that have Medicare Advantage plans, you're going to want to make sure that all of your docs are still in network and that all of your prescriptions are in formulary. For people that have prescription drug plans, there's going to be some shifts in the formulary. There's also going to be some consolidation of fewer drug plans in the marketplace. Make sure that the prescriptions that you are taking are in the formulary. So let's recap. The IRA will bring changes to Medicare in 2025. The good news is that at last we're going to see a maximum out-of-pocket cap of $2,000 on your prescription drug coverage. The donut hole will be gone, and you, if you've got expensive prescription drugs, will be able to smooth those costs over 12 months in monthly payments. The disruptive news is that changes are coming to your plan, your benefits, your network, and your formulary. So I encourage you to read your ANOC very, very carefully. In addition to this, I'm calling it a perfect storm, unrelated to the Inflation Reduction Act, is people that have a Medigap plan are likely going to see a 12 to 18% increase in premium being announced for 2025. Not related to the Inflation Reduction Act. Here's what's going on there is during COVID, in the COVID year and then coming out of COVID, claims were down in the usage of those plans, mainly because people could not get into the doctors and people didn't want to go to their doctors. So there were fewer claims. So there was no reason to increase the premiums. Now, coming out of COVID, a lot of people that put off medical procedures are catching up, and people that had put off medical procedures may have become sicker. So claims have gone up on those plans, which is why there's now going to be a premium increase in those plans as well. There is a lot of confusion out there. I've received a lot of phone calls already on this, and where there's chaos in the marketplace, there is that opportunity for bad actors to scam you. So I want to take this moment to remind you, Medicare will never, ever, ever call you unless you call them first. It is illegal for a Medicare insurance agent to call you unsolicited unless you already have an established relationship with that agent. Do not ever give personal information for somebody that is calling you and saying that they are from Medicare. The best course of action is to simply hang up. Beware of bait. There's going to be a lot of invitations to click on email links and click on internet links. Don't click on the internet stories and special offers. You may not realize it, but when you do click those offers, you're actually giving somebody permission to call you. Avoid the 1-800 numbers. And if you feel you've been scammed, you want to report your scam, at oig.ssa.org. You may be wondering, who can I trust and where do I go? What are my safe resources? www.medicare.gov is the website from the Centers of Medicare and Medicaid. It is a tremendous resource. If you haven't been there, I encourage you to go there. You can put in your zip code and you can see all of the plans that are offered in the area. CMS rewards all of these stars a universal star rating system that goes from 0 stars, too soon to tell, to 5 stars being the most stars that you can get. And every single plan is evaluated with that universal star rating system. So that is a great resource. Also, the state health insurance plan, otherwise known as SHIP in Maine, it is your areas on aging, are a great resource to help you navigate and see what plans might be good options for you. And then also licensed independent insurance agents like myself. It does not cost anything to have an insurance agent. I would say this year, if you don't have an insurance agent, it might be a good year to find an insurance agent. If you do have an insurance agent, this is definitely the year to connect with your licensed insurance agent just to make sure that you are in the right plan. I am a licensed insurance agent here in Maine. I work local. And if you don't have an agent and would like some assistance, I'm here to help. And I want to thank you for joining me today. Stay safe this Medicare season and have a great day. Thanks for joining me. Bye-bye.